Sara, thank you so much for joining us today and our audience to talk to us a little bit about your work at CIPC and health advocacy in general. I want to welcome you, and I'm really curious to have a conversation with you, even though we get to work together. I feel like there isn't always opportunity for us in our day-to-day work to really understand where we come to this work from and how meaningful and how deeply it resonates with us. So I was hoping that I could talk to you this afternoon and you could tell all of us really a little bit about yourself and maybe what brought you to this work.
For sure. Thank you so much, Sumit. So my name is Sara Dar. I am our Health and Public Benefits Policy Director. I've been with CIPC more than 3.5 years, going on 4 years pretty soon. My background, I studied public health. I did my master's in public health, and I spent a lot of time when I was in school, in undergrad and grad school, looking at the healthcare system and how healthcare is provided to people and policy as well. And I knew I wanted to work on policy. At that level of my education, I learned that policy is made just by policymakers. And so that's sort of like the avenue. But then while I was in grad school, I did an internship with a grassroots advocacy organization, actually in my home state of Minnesota. And it's called Take Action Minnesota. And that was my first introduction to community organizing, to the theories around community organizing, to grassroots power building organizations. And it changed the whole trajectory of the rest of my life and my work and my career. And I learned that some really powerful campaigns can be won, and really impactful change and policy can be implemented by building grassroots power. And so it set me off into a trajectory of, the intersection of policy and community organizing. And I've worked, in a number of those types of spaces in the past. And when I landed at CIPC, it was just a beautiful intersection of all of that kind of work. So we've got really great policy minds. And at the same time, we have a value system and a theory of change that's grounded in grassroots base building, grassroots organizing, and leadership development for folks that are directly impacted. And that is sort of the journey that I've been on since I joined CIPC, and it's been a wonderful one.
It feels like you really sort of began in health and have really moved kind of your work forward all the way, literally from Minnesota to California. And I was wondering if you could tell me a little bit, Sara, and our audience a little bit about the work that you do here at CIPC, specifically related to health, and kind of maybe a little bit about the history of this work. Has it been easy to do? You have lived in 2 different states, so perhaps in Minnesota, it may have been more difficult than in California. It would be really helpful to kind of understand what it's like to work on these policies.
Yeah, well, a story that I will never get tired of telling is the story of the Health for All campaign. It's one of our core and major campaigns in the Health and Public Benefits department. We do some other work as well, but this is just a campaign that's near and dear to my heart. It's the first one I worked on when I started at CIPC. And it existed and was built up and created, and the foundation for it was laid by so many wonderful individuals and organizations that came before me. And it's been an honor to get to know all of them. And so, it started out with just with some directly impacted people, individuals who are undocumented themselves or have undocumented loved ones, as well as folks from the advocacy community who are not directly impacted but are deeply invested in these values and in seeing this type of change, coming together and starting something and really having no idea if it was going to work, where it was going to lead, how long it was going to take. And when I joined CIPC, it was right after the first big win for this campaign had just been implemented. And so we are only one of, I think, 5 or 6 states, 5 states in the District of Columbia, who have our Medicaid program available to undocumented kids ages 18 and under. And that's something this coalition fought really hard for. And then we kept fighting, and it's been, year in, year out, we go back to the legislature, we go back to the governor with our proposals, and some years we don't get the policy win that we're looking for, but it's about sort of keeping our eye on the prize and on that long-term goal. Big structural change like this doesn't happen overnight, and it's just been an awesome journey to be on with the coalition. After a couple years, we were able to take another step and build on the win for kids and become the first state and the only state still in the country to expand Medicaid to any adult population. And so now, starting January of this year, young adults ages 19 to 25 in the state of California, regardless of immigration status, can also get Medicaid. And in California, we call it Medi-Cal, and it's a wonderful healthcare program that really provides comprehensive coverage. And we are working now to make sure that everybody knows about that. It's one thing to win the policy, it's another thing to make sure everybody knows about it and is signing up and actually benefiting from it and has access to it. So that's another whole phase of our work that we've been focused on this year. The campaign and the coalition, when they first set out, they set their sights on Medi-Cal access for all undocumented Californians, regardless of their age. And so we've known since day one that our work continues. We are still fighting for everybody who is older than the age of 26, our parents, our siblings, our grandparents, and our elders. And so, we're just, we're continuing to fight. And it's truly like being part of like a journey. There's chapters in the book, there's chapters in the story, there's highs and there's lows, there's really difficult moments, but we are, just committed, and it's really a really collective effort with groups all over the state, from Sacramento all the way down to San Diego. We couldn't do it without everybody.
Oh my gosh, Sara, that's so important. Thank you so much for highlighting the need for this kind of healthcare and preventative care. And it's so interesting to hear kind of the history of how we've really been working on this for so many years. I'm really curious, actually, if you could talk a little bit about how COVID may have impacted the work that we've been doing outside of a healthcare pandemic. Has there been, can you tell me a little bit more, and our audience a little bit more, has there been, more emphasis on the need for healthcare? And where do we stand on healthcare as California leader? I think you talked a little bit about how we're only one of 5 states, or including the District of Columbia, but like, how do we stand when it comes to, particularly in light of COVID?
The onset of this pandemic, what it's done is it has, and a lot of people in the health equity movement are talking about this. It has laid bare how our healthcare system and our infrastructure and our policy as it currently is really failing so many of our communities. And specifically, that's communities of color and immigrants in really unique ways as well. And so all the things we've been fighting for and been talking about have just become more starkly and sharply in focus. These issues are not new, but a broader swath of our communities are paying attention to them now. And so it's really been a moment of us to say, now's the time for this reckoning. These issues that groups like CIPC have been talking about and fighting for so long, they've been, the veil has been lifted for those that still were not aware of why these things matter, why our healthcare is all, the health of one of us is tied to the health of all of us, and how our systems and our policies need to be set up to take care of everybody. Taking care of some people and excluding others is just not going to work. And so this moment has really made that clear. And so we've been, really fighting tooth and nail to make sure that whatever we do, whatever policies our governor's administration, our legislature put in place to try to recover from this pandemic, whatever that recovery looks like, cannot work and will not work. We will not be able to rebuild if our policies and our recovery strategies are only for a few and not for everybody. And that's what we've been trying to highlight for immigrant communities, regardless of status, who live here in California and call California home.
Sara, this has been so informative, really just understanding where we are in California and sort of your bird's eye view of taking us into what it's like to be a health policy advocate and really some of the challenges and also maybe some of the excitement for the wins. But can you tell us a little bit about the community and the impacts of the policies that we are working towards?
I'm talking to young folks and asking them to tell me and to tell the governor and to tell the legislature what this would mean to them. And I remember hearing stories from undocumented young people who were, just starting out in college, that 19 to 25 age range, who, literally couldn't read the board when they were sitting in their classroom because they just needed glasses. And it wasn't something, as you know, trying to get healthcare anywhere in the United States out of pocket without like an insurance card and just paying out of your own pocket full price for any of those services, including eyeglasses, is just out of reach for many people. And so I talked to young people who were like, I just need that pair of glasses to see the board to literally do well in school. Like my whole future is riding on this. And then when that young adults expansion passed, checking in with those people and hearing them, talk about how they were able to finally go see the eye doctor and it changed their life to be able to just get a pair of eyeglasses. And so it might seem like, okay, a win for just 19 to 25-year-olds, it's such a small population. What does that really mean? But when you look at it from the perspective of an individual, it's life-changing. And then, I think about the older adults and the elders who we've been talking to as we've been pushing for an expansion for our seniors 65 and older who still aren't covered. I think about people like Emma, who some of us at CIPC have affectionately called her Tita Emma because she's kind of like a Filipino auntie to a lot of us. Talking to her while I'm on the plane going to Sacramento, where she's about to share her story with legislators and learning more about her experience as a home care worker. Many people don't even realize that you can be a home care worker in the state of California. You can go and be a live-in aide and take care of elders and other people's grandparents round the clock. This is a round-the-clock job where you're living in with them in their home, and not even have health insurance for yourself as an undocumented elder yourself. And her talking about what that would mean for her and her ability to, continue taking care of her own patients and worry about her own health. She's a cancer survivor, talking to people like that makes it really clear and kind of relatable what these policies mean for individual people.
You've really raised, I love hearing these stories from you, and I'm sure many people love hearing these stories because they actually really make us think through what people are missing out on, or even the irony of being a healthcare worker and yet not having access to healthcare. So I really appreciate your touching upon some of these really important stories that we actually just don't get to hear about when we think about policy, right? And we think about bills. And so that kind of brings me back to why we're here. I was wondering if you could talk a little bit about, policy en paletas and sort of this work and the reason that one might have a fundraiser at this time of year.
I'm so excited to talk about policy en paletas because right now, especially when a lot of us are sheltering in place and we can't gather together in person, many people are feeling really isolated, and like it's even harder to do this movement work when you can't get together in person, right? When you're just like sitting in front of a screen. And so to do, to get on the internet and see each other on video and have those wonderful, robust conversations about art and movement work and why we do this work and just be in community together is something I'm super looking forward to. And, we can all grab our paletas or our favorite ice cream or our favorite dessert or drink and enjoy it, still as if we're all together in person. We do need all the support we can get, whether it's a $5 donation or a $50 donation, all of it matters. Every single penny matters. And so we do ask for our supporters, those that are involved in our work, and maybe those that are outside observers who can't be a part of this work day to day, but want to help lift it up. Every bit of support counts. It matters. And, we're going to keep fighting, and we want all of you to have a stake in that.
Thank you so much, Sara. This was so helpful and really helped all of us understand a little bit about your day-to-day work actually at CIPC, but also how we can all make an impact and be helpful. And I hope everyone here takes a moment to take a look at CIPC's social media platforms, particularly Facebook, to RSVP for Policy Impaletas. Even though, the legislature was done on August 31st, the work still continues, as you very much have pointed out and illustrated and reflected through these really important stories. And most importantly, our communities are still impacted. And so our work continues. And so we really hope that folks will take a look, consider any donation as you suggested, and really to join us, to join you and other, policy leads, our CIPC staff who supports everyone, and artists and other advocates who continue to urge and partner our congressional leadership to really create a California for all. So we hope to see all of you there. And thank you so much for joining us, Sara.
Thank you, Sumit, and see you guys all at Policy Impaletas. I'm so looking forward to it.
See you September 24th.